The number one mistake men make with cancer, they try to go it alone. You put on the armor, keep quiet about your pain, and think toughness will carry you through. But that choice is costing men their health, their relationships, and even their survival.
Men, we tend to not be transparent with our doctors when we're either having a symptom or something's painful. You just kind of go on. Don't do that. Be transparent.
Paul has lived this. He's leaned on his wife, built a medical team across 3 hospitals, and mentors men worldwide through Man Up to Cancer.
You got to change everything and figure out what that means for you. But change the, like pick up every tool that you can. I'm the coach of my journey, and these are my team members that I'm going to use on that field to try to get to my goal.
In this episode, you'll discover how to build your own crew, why hiding your pain makes recovery harder, and the mindset shift that lets you reclaim power, even with cancer in the room. So if you're ready to stop going it alone and start building your crew, let's dive in.
I feel like as cancer patients, we don't know what the full menu is of things that we can do. It kind of depends on who you
Right.
talk to, right? And there's actually something that I serve on the UCSF PFAC board, and this is a
With
topic
me.
with you exactly. This is a topic like how do we get the right information to a patient at the right time? Because the other challenge is as patient, you can't hear everything. It's just there's too
Right.
much coming at you. Um, and I do think that the other thing that's challenging, and as I mentor people, I try to reinforce this point. Like, not everyone's cancer journey is the same, even if you're on the exact same protocol. Um,
Different bodies,
exactly, different
different
bodies.
responses.
Yeah, and in practice, chemo is a blunt instrument.
I mean, that's part of why I wrote the book and why I'm doing the podcast
Mhm.
is to say, how do we make available the answers to a question that you will have, but you probably don't at the very beginning,
That's right.
right? There's a lot, like round when you faced chemotherapy the second time,
Yeah,
you were way more informed about what you needed and how to make it better for yourself than you were the first time. For me, because my first time was in 1985 with my mother,
Mhm.
I had a large collection of resources
Right.
that were available. At the very beginning, you can't hear anything. You're just thinking, am I going to live or die?
That's right.
And then you get all these in minutia details.
And I actually think it's good that you're bringing this up. I think even the first time I thought I had it dialed at the end of my first chemo cycle, but they changed the drugs the second one. So
Sure.
my immunotherapy was different. My side effects are different. So half the menu was red, but I now had to learn a whole bunch of stuff. And I do think it's important
Hmm.
as you're going through these treatments. Well, there's two things going on. Research tends to be trailing, right? It's the information
Hmm.
is old, and there's some rules around when you can release things. And then the medical industry is moving very quickly. And so it's almost critical that either you're able to try to stay on top as much as you can of the things surrounding your diagnosis, or you've got someone who can do that for you.
Hmm.
The case that was more my wife because I didn't want to go down the rabbit hole of all the cancer stuff all the time, but she was willing to do
Right.
that and bring that to me when she found something that was relevant. And yeah, I would recommend if you can find someone that can help you, even something as simple as what you're talking about, the ice capping and the mittens. Yeah,
They were,
it sounds
yeah,
terrible, but in practice, it
it
does
is.
help people.
Yeah, no, I will say of all the things I did to mitigate side effects, the ice mittens and the ice socks were my least favorite. But but I don't have neuropathy. And maybe I wouldn't have, don't know.
Yeah.
Not going to do it on one side and not the other to find out. But it was I think another piece of advice, your wife did this, is engaging in some of the online support groups
Mhm.
and asking good questions. Hey, for someone who's had this, what were the side effects you experienced and what worked to mitigate them? Which isn't a promise that it'll work for you. All bodies are different.
Right.
But, as soon as you knew you were having, I knew I was having a carboplatin and I knew neuropathy was a side effect, I could, I mean, of course, I have the familial focus group, support group, but, but I could ask people like, So, is there any way to prevent any of these things?
Right.
And the challenge with like the ice mittens and the ice socks is the FDA hasn't approved them. It's not, it's not like some of the other things, but the nurse will tell you, the doctor may tell you,
Yeah.
the support groups will definitely give you ideas. And my only caveat on that is if the ideas are something you put in your body, like a supplement, you need to talk to your doctors before you put anything in your body because your body is a chemistry experiment at this point.
Yeah, I do. I've participated in some Eastern medicine, and definitely, even if they're like, well, here's some herbs to help you with whatever, run it by the
Hmm.
pharmacy. They might tell you you're on these other drugs and don't do that, or they might say
Right.
we're not going to tell you these will medically change anything, but we're also not going to tell you that you can't do it. And they'll do that with. There's a few things that's the answer, and then it's up to you.
And that's a fine answer.
Hmm.
I mean, if it's not going to do harm and it might help
Right.
and you want to do it, you can tolerate it, great. But don't hide things from your medical team. Tell them,
Yeah.
ask them, because, the internet might be a good source of ideas, but it's not a great source of definitive science.
And I love that you brought up the don't hide things thing. I think as men, we tend to not be transparent with our doctors when we're either having a symptom or something's painful or right, you can just kind of go on. Don't do that. This is your you transparent.
So let's talk about being a man with cancer, because I don't know that experience. I find men that I talk to are more hesitant to tell people. They seem more lonely going through this. And, you mentioned that almost every man you've talked to who had cancer has become very emotional
Yeah.
during treatment. Like, how did that show up for you? And tell me, what is your experience like facing this as a man and talking with so many other men?
I'm stage 4 CRC, so just even having colorectal cancer or saying that word is kind of like, what is that? So I do think there's
Oh,
a little bit
please.
of
Apparently the whole legislature of North Carolina is uncomfortable with the word breasts.
right.
So,
So yeah, so there's some stigma there, and then I do think men are, there's this idea that you need to be the lone, super tough, whatever that picture is, and it's just wrong. Like I think the thing that happens to you when you're going through cancer is you really, well, hopefully you've got people that are there to support you, and you really realize the importance of community and it does make you a little more emotional for sure because you can for me I think it's what a 20% survival rate past 2 years. Uh,
so you've already beat the odds. Congratulations.
right, but there you're doing so like for me I talked about those goals like some of the goals I set were I just want to see my kid graduate college, my youngest.
Yep.
I want to see my middle kid find her person, right? I want to see my older kid find his person. You're setting these things that are like crazy, but you're dealing with a time horizon that's short. And I do think it refocuses you on what's important. And maybe as a secondary effect of that, like, I cry at Hallmark movies now, which is pretty, like, I've heard that from a lot of guys. It's pretty funny to me.
We often are uncomfortable with men having a whole bunch of feelings and we tell them they're not allowed to show them.
Right.
But they have them. And so the advice when we had little ones was use the words.
Hmm.
Describe, put the words on the feelings to give them the vocabulary and let them know it's okay to talk about your feelings.
Yeah.
And I think for men going through cancer, the feelings get so powerful, so strong.
Right.
They need an outlet. So besides your wife, where it sounds like you have a great relationship and your three kids, how did you find outlets and a way to process all of these very strong emotions?
I did a few things. I have some close friends that have been in their cancer battle a little bit longer than me. So I connected with them. We also put in place a means of controlling information in and out to me.
Mhm.
One thing cancer patients hate is the "How are you doing?" question that you might get from people. So we intentionally set up a set of circles and used a website to publish my status out to people, uh, which wasn't just like, here's what's going on with cancer, but here's also what's going on with us, just to try
Mhm.
to minimize some of that negative energy coming in. And then I found a group called Man Up to Cancer. It's a nonprofit organization. It is solely men, so it's men supporting men. All of us are either survivors or very actively in it. And you can choose to engage how you want. It's broken up into chapters. And I want to read something because I think Trevor states it much better than I ever will.
Great.
uh,
And we'll put a link to Man Up to Cancer in the show notes,
yeah,
so people will be able to find it if they want to discover a chapter near them. But please,
yeah.
let's hear Trevor.
So, uh, open quote, when faced with cancer, women tend to reach out and men tend to check out. This leads men down a path towards mental health problems, strained relationships, and poor medical outcomes. So the survivor rate, actually, you can see, is much lower for men who create, don't engage with community. Um, so he says it's time for a new path. We're changing what it means to man up in the face of cancer. It's not just about being tough. It means having the courage to accept help and knowing we're smarter and stronger as a pack than we are as lone wolves.
Fantastic. Fantastic. And how did your wife feel about you reaching out and working with men, Man Up to Cancer?
She's been super supportive of me engaging, including one thing I started doing kind of more selfishly or just kind of serendipity, I guess. I started having people coming into my life who needed mentorship. And so, yeah, I think it's important to share what you're going through and help others get through it as well. And that's kind of a core tenet of what this group is about. Uh, and use the knowledge of your pack to try to get through the best that you can with the experience.
Absolutely. And I think it helps to be able to say, did you ever have this? Are my feelings weird? I mean,
Yeah,
you because the emotions run the gambit. You get angry, you get sad, you sometimes feel silly.
yeah.
It is absurd. We have scars and parts of our bodies don't work the way they used to, and that's shameful or embarrassing. And how do you just deal with it?
And
How do you deal with, your partner?
yeah, and I think there's depending on the type of cancer that you have, you could be losing uh, uh, parts of you that define you as a man or a woman. I had some friends that are have to go through some therapy where they, lose their ability to be intimate with their significant other, and it's just that's a hard choice to make, right?
Mm-hmm.
As a man, so I think being able to openly talk with other folks about that and know that it's not unique to you and not have talking to your doctor only, right? Is important.
Right, and not a clinical, like
Yeah,
like a big brother, like a friend, someone who can let you know what's going to suck, but maybe some ways to get creative or work
that's
around
right.
or, you know, find, if you will, intimacy through new ways.
Yeah.
So, so what is your core message to men when they're just getting their diagnosis, especially around this taking medications and, I'm going to just tough it out. I'm going to endure the pain.
Yeah, don't do that. I think definitely over communicate. I know I've heard from people that I've talked to, I don't want to bother my doc with that. They're there to be bothered.
Mm-hmm.
I think the second thing I always tell people is build your team. Like the doctors are there to work for you, and you don't have to just rely on one doc. Like I have people from three different hospitals that I engage with on a regular basis, Uh,
Hmm.
and I think it's important to understand the difference between what an oncologist's point of view and role is versus what a surgeon's role is versus what I mean. I probably have like 10 people that I engage with in one form or another to figure out what the right course forward is.
Hmm.
And you've seen this. Like our oncologists are overwhelmed.
Oh my God, there's so many patients
Yeah, well,
and so much science and so much
and
innovation.
then the people that are supposed to be helping with them are spending their time fighting with insurance to get stuff that you're trying to get done.
Right. Right. It's insane.
It's tough.
It's
Feel
insane.
for them.
Yeah. All right. I want to do a lightning round, but I want to go back a minute to your superpower.
Mm.
And you had a superpower for enduring chemo because I've been learning through people I talk to on the show about the incredible science behind exercise oncology.
Hmm.
And there's an episode come with Dr. Jay Harness where he talks about 35 years of studies and evidence, but they were all on the fitness side. They were all on the kinesiology world. They didn't make it over to the oncology and surgical worlds until the last couple. But things like, I know prostate isn't your thing, but the British Journal of Oncology, I believe, reported this week or late last week on a study in Canada that had a 61% reduction in recurrence after prostate cancer stage 2 surgery if you exercised rigorously. There's a bunch of studies that are showing that exercising during chemo reduces side effects. Your point, right? About you had the superpower. And there's no question that being fit and exercising and then having surgery helps you with recovery because your body is good at the muscle of recovery,
Hmm.
right? So kudos to you for always being an athlete. And hopefully that has helped you
Yeah.
in your cancer experience.
So I play contact sports early in life, and I think for anyone that's played football or rugby, because you're constantly having that contact, you recover faster from it. So if you think about
Mm-hmm.
that relative to chemo is beating your body up, right? And you're using that exercise to give your body the what it needs, including blood flow, which is massively important to try to
Mm-hmm.
recover. I actually did that in combination with acupuncture. So I would use acupuncture before my chemo regimen and afterwards. So to prepare my body to receive those drugs and then to clear those drugs out of my body as quickly as possible
Mm-hmm.
afterwards. Um, Interestingly enough,
Excellent.
I didn't. I walked the whole time the first chemotherapy rounds. The second time, I was on a drug where I could not be in the sun. It would give me really bad rashes, and so I picked up swimming and swam indoors for that whole thing. But again, it was definitely about doing the exercise you can. And I have to reinforce this with people. Like I was able to do what I was able to do. You may not be able to do that. Some people, it's
Sure.
the chemo is just too much. Your body will tell you.
Yeah. And just even if all you can do is
That's right.
walk a little bit. All right, let's do the lightning
Okay.
round. Um, all right, 5 questions, just your immediate answer. Best cancer advice you received.
Lean into my wife. Be transparent with her.
Nice. The biggest surprise about treatment.
Uh, I would say it. This is a roller coaster. Um, this for me at least, definitely not a one and done thing. I think I was definitely when it came back, I was angry and uh, I was surprised. I think maybe because I just had too much hope. But a good friend of mine said, "Welcome to the roller coaster," and I think it's important to be practical about that.
I call it the world's worst amusement park.
That's right.
We just don't want to spend any extra time there.
No,
All right, one thing you'd change about your journey.
I don't know that I would change anything. I think um, we've been as aggressive as we can be. Maybe now, probably the mittens.
Mittens, right. Freeze your hands and feet.
Yeah,
I looked ridiculous, right? I had a cold cap on my head, hands and feet in ice,
yeah,
and the rest of me covered in
that's
blankets
right.
because I was just trying to not be
Because the
cold.
drugs are freezing you, and you're
It's
like,
right. I was some sort of very weird astronaut. Okay. You have what you call a cancer tourist detector. What is a cancer tourist?
yeah. And so this kind of goes back to this idea of trying to keep people in your orbit who are going to build you up. As odd as it might sound, there are people that want to like engage with you because they want to say they know someone who's got cancer or they want to be able to tell that story, and that doesn't do anything for you. And so I do think it's interesting, and I've heard this from a lot of cancer patients I've talked to. You kind of go through this exercise of trimming who's around you. You may actually
Mhm.
pull in new people that you didn't even think that you didn't have a relationship with before because of kind of common experience, or that they just come into your orbit and help you kind of move forward.
Yep. Okay. What's your advice to anyone starting their cancer journey to kick cancer's ass?
Uh, you got to change everything and figure out what that means for you. But change the like pick up every tool that you can that you're willing to pick up, and like get rid of any fixed mindset. I didn't meditate before I started uh, fighting cancer. I would have never done acupuncture. Change the way that I eat. Uh, yeah, you almost have to think of yourself as being reborn a little bit because you're going to be changed. And I think openly embracing that, and being open to ideas, asking questions, uh, not just trusting your doctor, like they're there, but you are an equal part of that conversation. I like to say that like I'm the coach of my journey, and these are my team members that I'm going to use on that field to try to get to my goal. Um,
Hmm.
and I think coming in, I've mentored people that haven't done that. And I will tell you their cancer journey has been a lot rougher. They haven't gotten kind of where they need to be as quickly as they should have because they haven't adopted that mindset.
So, a mindset that's curious and open and partnering
Yeah.
with the team. I think. Did you find that cancer changed you to be more like that outside of cancer? Like, how did cancer change you?
I'm kind of wired that way anyway. I think through COVID, I was had this mantra around giving other people grace. Like you don't know what's going on in their life. I think this doubled down on that. I think the thing that changed me is having to face my own mortality, and chemo sucks. There's no two ways around that. But you can go into that with a mindset of I'm just going to suffer through this, or I'm doing this because I want to kick cancer's ass. I think if you don't take that latter approach, it's going to be a tough road for you.
There's a whole chapter in my book about how I transformed Infusion Day
Hmm.
from this day sucks to a day that had a series of things happen that kept making me smile. I'll give you an example. This is Stego, okay? Stego was given to me by my husband when I got my port, which I named, by the way. Do you know I named?
Told me that.
Yes, Voldeport was my name. And so when Voldeport joined me, I still miss Voldeport, but I'm glad it's gone now. I also got Stego.
Hmm.
Well, Stego has a unique characteristic. Stego's head is roughly the size of my wrist. And so, much to the chagrin of my nurses, I would slip my bracelet off before putting on these ice mittens.
Yeah.
I'd put it on Stego's neck,
Uh-huh.
and I'd lay back, I'd have my head in a helmet, my hands are freezing, my feet are freezing, but they gave me Benadryl. So with me and Stego, I'd go to sleep.
Right.
And they could confirm it was me and check for when they're changing the drugs without waking me up.
Awesome.
Right? So, like, everyone knew Stego, right? I got my letter from my son. We laughed about Voldeport. I had people who sent me jokes that day or visited with me that day. And each one of these happiness tripwires released three key hormones. And to your point, like, grinding it out doesn't give you this.
No.
an attitude of I'm going to kick cancer's ass and I'm just going to be open to how do I make this rather sucky experience just like 1% better. So here are the three hormones. Serotonin
Mm.
relaxes you, dopamine gives you focus, and
Yeah.
oxytocin, which actually makes you feel connected. So you actually have a little more energy, feel a little more focused. But the thing I didn't know about those three hormones is they boost your immune.
Right.
Well, if you're doing the acupuncture and you're trying to make your body as tolerant of this regimen,
Mm.
this stuff's free and non-toxic.
That's right. Yeah. We had our ritual was, I should have said this earlier. So my wife's super crafty. She would make cookies, but they were super decorated. Like she'll probably send you a couple of examples, just so you can see what I'm talking about.
Awesome.
So the nurses, and we'd bring them for the nurses. That was the whole thing. Is like, I will shout out to oncology nurses. They're very special people. So we bring them these cookies every time I went in, and it was just kind of a cool thing to just give them something so that their day would be a little bit better.
And then they were happier, which made you happier.
Exactly.
And but that smile that you just had, that's the release. If you sit in it for a second, you can feel the hormones run over you.
Yeah.
And for that 10 seconds, you just feel better. You feel good. And I'll take little 10-second doses of feeling good as much as we can.
For sure. Especially when you're sitting in that chair.
Right. They try to make it a comfortable chair, but there's almost any place else you'd rather be.
Yeah. For sure.
So if you feel like you have no support, it sounds like your advice is A, ask for mentors or a support group or something. There are people who want to help share what they've learned and support you. And just so people know, everyone's trained. When you sign up to be a
Yeah.
mentor, there's a training process, and people aren't using you to work through their own shit. They're
And then
there to help you.
in
And
transparency,
two,
I
go
was,
ahead.
because people were kind of coming into my orbit, uh, I was mentoring with no training. I now am part of two mentor groups where I've had training.
Hmm.
I've also given them feedback on giving us some amount of grief training because reality is a lot of people don't survive this disease. So yeah, you're right. I think and seek out the thing that's right for you. Not support groups are correct for you.
The other thing is sometimes the feeling of not having support
Mhm.
is not letting people support you, having some set of rules in your mind about who is okay and who isn't. Like people are afraid at work to talk about cancer, but there are people show up if you put out there, hey, this is
Yeah,
going on.
I
It's
think
just going
you
on.
gotta put on your empathy hat and figure out. In some sense, there are people that want to engage with you because they might have some cancer past in their they're feeling the need to want to connect and help with that. And I think the key thing there is just making sure that it's the right relationship for you and that is going to be a positive for both of you. Um, and not, feeling
Mhm.
like you've inherited a cancer curse and you're spending a lot of your energy and time.
Showing them the
Yeah.
sights, right? We don't need to show the
I
cancer
think,
tourists the sights, but I think you can also. People were very appreciative, Paul, when because I was diagnosed the day before I was supposed to have a prophylactic bilateral mastectomy. So I had a few hundred
mm,
people who knew I was having surgery that I had to tell I'm not having surgery, and I had to say because I have cancer and I don't have any
yeah,
answers. But I did tell them all, here's what I need. I need an oncologist. I don't need to hear
mm,
about all your friends who've had this. I've got my own selection. I don't need any links from Google or WebMD. I'm good. And I would love to hear jokes or fun things going on in your life or pictures of your kids, your pets, your birds. I don't care. But things that are more normal. And I intend to work. So if you work with me, please don't
right.
make decisions for me. I'll tell you what I can and can't do. And besides the fact that I felt good telling people, this is what I need, this is what I don't, I've gotten so many comments from people about how helpful it was to be told what they could
Yeah.
do
Yeah, I think
and
people don't
what
know
I
how to
needed.
engage. Like and I do blame the media a little bit for this because it portrays cancer patients a certain way, and it's like, uh, in both of our cases, we were fully capable and didn't want to be treated differently, especially in a professional.
Right, right. I mean, the there were a couple of days I worked from the couch, but my, you know, from the neck up, I seemed to still be fine. So,
Yeah.
it was good. Paul, this was awesome. I really thank you for sharing your vulnerability, your wisdom, your journey. And I know your journey, and is any of our journeys over, but I know your journey isn't over. But I hope you continue to kick cancer's ass, you continue to beat the odds, and that not only do you hit the milestones you want to hit, but you hit them with such ease that you're setting new ones.